I am going to show you kind of the dynamics of getting a facial analysis done. So we've entered her information. Name and birthday are the most important. You can add as much or as little information as you want. We're going to start the shooting. We're going to put your chin here, forehead on those two, yep, and close your eyes for me. You're going to lower the hood. The advantage of the hood is that it's going to eliminate any natural light, so you always get amazing before and after photos. That is as fast as the shooting was, right? So you can come out. It populates her images, and then it will prompt you next to do the moisture reading. So we're going to do a quick moisture reading. So first the forehead, then the right cheek, and the left. So we got all 3 moisture readings done. We're going to save that, and we're going to go into our skin analysis. So I'm going to show you some features of the skin analysis and kind of walk you through an analysis. First and foremost, once the images are taken, it's going to prompt you to take a moisture reader. So the moisture reader looks like this. It takes a quick read on your forehead, on your right cheek, and then on your left cheek. So you are able to address dry skin if they need moisturizer. This is an opportunity for you to sell something like a hyaluronic acid or a hydrating facial, etc. Then this is an AI component to the analysis. It's going to map out the patient's skin. But if you notice that, say they have a static wrinkle or they have expressed that their under eyes are an area of concern, you can move these around and adjust them in order to accommodate for what their concerns are as well. Then you're going to start your analysis. The whole process can be as simple or as complex as you want it to be. And I'll kind of walk you through that. So this is a summary screen. Anything in red needs to be addressed or is negative, right? Anything in blue is positive. So she's super young. She's actually doing better. It's rating her skin age younger than her actual age, which is amazing. But it does highlight the 2 main issues that you're going to want to address. I use this as a summary screen. So oftentimes it'll default here. They'll start to see things like, oh, what does that mean? What does that mean? Now I'm going to walk you through the actual analysis. So first, you have pores. It does actually highlight your pores to the point of being able to click on them, make them 3D, and just see, how deep or how quantifiable these pores are. You can chromatize it and digitize it. So if you see a lot of differentiation in texture or pore size, you can save this here and use this as a reference later on down the road with improvement to your treatment protocol. She falls 6 worse off than those of her average age group. So this her customer figure is 35. The average age group is 29. So this is definitely an area that you're going to want to address. Now, what can address pore size? A lot of times pore size is congruent with the amount of oil production. And in a younger patient, you're going to see that quite often. I'm going to actually go to oil. She has very little oil, so that's not the case. But for pores, you can do hydrodermabrasion, so the cytopeel would be amazing. RF microneedling, so the cyto-RF would be amazing. Microneedling, so the cytopen would be amazing. Truly, though, she'd also want to have some sort of retinol to cause cell turnover and limit the amount of sebaceous activity and the amount of pore size. Moving on, you have wrinkles. So she's right there with her average age group, not necessarily something that we need to address. But if there was, and I'll just pull this up. So when your pores start to align, it will actually highlight them in blue. And those are where your wrinkles are starting to form. So this is your opportunity to sell your neuromodulator, right? So we're going to use about 18 units, 25 units, whatever. You as a practitioner are going to recommend this. And then what you'll do is you'll go to that cart where you would have already logged in all of these different products and services, and you will move those over into her cart. It will save at the bottom as a part of their treatment plan. Nasolabial folds. She's -2, so meaning she's 2 better off than those of her average age group. Not necessarily something we need to address on her. However, if this was an issue and you're an injector, we know that mid-face fill is going to help lift that. cheek filler, sometimes even in the marionettes and the nasolabial folds. And so this is your opportunity, even down here where it does stress that the left side's a little worse off than the right side. A lot of times patients come in and they say, you know, I only need 1 syringe of filler. Well, how do you know what you need? I'm the practitioner, right? So again, it takes away some of the control of the patient. A lot of times they think they only need 1 syringe of filler because that's all they want to pay for. Say, for instance, in this situation, she did need some. You could say, okay, well, you need about 3/4 of a syringe here, half a syringe here. Now you've moved her away from that 1 syringe. We're already into more than 1 syringe, right? So just an opportunity to utilize that as an injector. Elasticity. These little yellow lines are actually not just little yellow lines. It's based on the angle and outlined here. So she's one better off than those of her average age group. She's done amazing with her skin. But this here too is an opportunity where, you know, you see a little bit of a void over here on the left side. If we were going to do facial symmetry or jaw filling, we would fill more on the left side. So your opportunity as a practitioner to say, we probably need 1 syringe of here, you know, 3/4 of a syringe over here. Now we've moved her into upwards of 3 syringes. Same thing here with mid-face fill. There is an angular void on one side versus the other. So we know that if we do a mid-face fill, it's going to help lift the skin. It's going to change the angle of the elasticity and improve this even more. Now, as far as elasticity, what can we do? RF microneedling, cyto-RF, microneedling, cyto-pen. Those are all different things that are going to be able to address elasticity. Skin texture. So this basically just highlights the skin texture. She's actually 7 worse off than those of her average age group. Things like resurfacing, RF microneedling are all things that are going to help with skin texture. Also, your hydrodermabrasion, your cytopeel treatments are going to help with that. Skin pigment. So this is actually seeing epidermal pigment. So this is what we see with the naked eye. And then UV is seeing what lies below the surface of the skin. She's 16 better off than those of her average age group, which is amazing. A lot of times you'll see a lot of very dark dots here, kind of like a warning sign. If we don't do something about this, this is what it's going to look like, but she's amazing. So we don't have that example in the situation. If these were issues, what are we going to do? Mostly light-based treatments, right? So IPL, laser are going to be great for your spots and UV spots. Skin tone. This is the image that you're most often going to use for your actual before and after photos, simply because this is what they're used to seeing in the mirror. This is their natural skin tone. These little indicators right here, as long as they're very close together, meaning that her tonal appearance is very congruent. In this case, she's 8 better off than those of her average age group. If there was a lot of variation in this, that would mean there's dark darks and light lights on the skin, and it would be an issue. Redness, again, she doesn't have much at all, but if they were to see rosacea, you would see big pops of red, and that would be your opportunity to sell any of your products for rosacea. IPL and NDAG are great for that as well. Skin oil, we touched on this earlier. She doesn't have a whole lot, but I am going to show you. It actually shows you on a pore by pore basis the intensity or the amount of oil in any given pore. If this was somebody with a lot, you would see a lot of these little spikes in her nose, but she does an amazing job. Oil production, again, hydrodermabrasion, the cytopeel is going to help with that. IPL is going to help with that. A lot of your skincare products will help. Porphyrin, that would be bacteria, and those are highlighted in pink, so she's got very few of those, but again, and on an individualized pore by pore basis, you can see where that bacteria lies. She's 5 better off than those of her average age group. And then moisture. So we did take a moisture read on her. She was a little dry, so this would be an opportunity to, again, to sell one of those products or any of the services that are going to help hydrate her skin. And so going back, you know, we've gone through each one of these things. We've gone and suggested all of the treatments and services that would make sense for her. This is her summary. You can write your notes as your counselor here at the bottom, and then you can send it to the patient. So again, if you click here, there would be a QR code that would pop up, or here you could just email it to them, but they get the entire report, all of the images, and all of their treatment plan to take home with them. It's also easily integratable into most EMR systems. So the whole report saves as a PDF. All of the images save as JPEGs. You can just move them into the patient file. This helps a lot in practices where a lot of different people are doing consultations. One, it has a flow, right? Everybody follows the same flow. And two, depending on who's treating that patient on any given day, they're all following the same thing. So it really helps out the practice a lot.